Welcome to this technical instruction video on the use of artificial intelligence, AI, in healthcare industries. In this video, we will be discussing the various ways in which AI is being utilized in healthcare to improve patient outcomes and increase efficiency. We will also provide 10 examples of how AI is currently being integrated into healthcare systems. As we know, healthcare is a complex field that requires a great deal of attention to detail and accuracy. With the help of AI, healthcare professionals can streamline their processes and improve patient outcomes. AI has the ability to analyze large amounts of data quickly and accurately, which can lead to better diagnoses and treatments. Now let's take a look at 10 examples of how AI is being used in healthcare industries. 1. Medical imaging. One of the most common applications of AI in healthcare is medical imaging. Machine learning algorithms can analyze images from MRIs, CT scans, X-rays, and ultrasounds to help doctors detect diseases such as cancer or identify abnormalities that might have been missed by human experts. 2. Early diagnosis. Another area where AI is being used effectively is in early diagnosis. With the help of predictive models, doctors can quickly identify patients who are at risk for certain diseases or conditions such as diabetes or heart disease. This enables them to begin treatment before symptoms become severe. 3. Precision medicine. Precision medicine involves tailoring treatments to specific patients based on their genetic makeup or other factors such as lifestyle habits. By analyzing data from clinical trials and patient records, machine learning algorithms can predict which treatments are most likely to be effective for individual patients. 4. Clinical decision support. Clinical decision support tools offer suggestions for clinicians based on patient data and medical records. These tools use machine learning algorithms to identify potential diagnoses or suggest treatment options that may have been overlooked by human experts. 5. Drug discovery. AI has revolutionized drug discovery by allowing researchers to analyze vast amounts of data quickly and efficiently. Machine learning algorithms can identify potential drug targets and predict the effectiveness of various compounds, reducing the time and cost of developing new drugs. 6. Chatbots. AI-powered chatbots can be used to offer real-time assistance to patients who may have questions about their medications or treatment options. These chatbots can also help patients track their symptoms and provide reminders for appointments or medication schedules. 7. Electronic health records. Electronic health records, EHRs, are digital records of patient health information that are stored in a centralized database. AI can be used to analyze this data to identify trends, patterns, and potential risks that may not have been apparent with traditional record-keeping methods. 8. Robotics. Robots are being used in healthcare settings to perform tasks such as surgery or patient monitoring. By using machine learning algorithms, these robots can improve accuracy and reduce the risk of complications during procedures. 9. Remote monitoring. Remote monitoring devices such as wearables or implanted sensors allow doctors to monitor patients' vital signs or other health indicators from a distance. Machine learning algorithms can analyze this data in real time, alerting doctors to potential issues before they become severe. 10. Predictive maintenance. AI is being used in healthcare settings to monitor equipment such as MRI machines or ventilators for signs of wear or breakdowns. By predicting when maintenance is needed, hospitals can reduce downtime and ensure that critical equipment is always available when it's needed. Artificial intelligence, AI, is revolutionizing various fields, including healthcare. Its ability to analyze vast amounts of data quickly and accurately makes it a valuable tool in the medical industry. In this video, we will explore the benefits of AI in healthcare. 1. Improved patient outcome. One of the significant benefits of AI in healthcare is that it can help improve patient outcomes. By analyzing vast amounts of patient data, AI can help identify patterns and trends that would be difficult for humans to detect. This information can then be used to develop personalized treatment plans for each patient, improving their chances of recovery. For example, AI can analyze patient data from electronic health records, EHRs, to identify risk factors for certain diseases or conditions. This information can help doctors make faster and more accurate diagnoses, leading to earlier intervention and better outcomes. 2. Increased efficiency. AI can also help increase efficiency in healthcare settings. By automating repetitive tasks such as data entry and record keeping, AI frees up medical professionals' time to focus on more critical tasks such as patient care. In addition, AI-powered chatbots can assist patients with routine inquiries such as appointment scheduling or prescription refills, freeing up staff resources and reducing wait times for patients. 3. Enhanced diagnostics. AI's ability to learn from vast amounts of data makes it an excellent tool for enhancing diagnostics in healthcare. With access to large databases containing medical images and diagnostic reports, AI algorithms can detect patterns that may indicate specific diseases or conditions. For example, AI can analyze X-rays or MRI scans to detect signs of cancer or other abnormalities that might be missed by human radiologists. This technology has the potential to significantly improve early detection rates while reducing false positives. 4. Cost savings. Another benefit of AI in healthcare is cost savings. By automating tasks like record keeping and scheduling appointments, healthcare providers save time and money on administrative tasks. In addition, by detecting diseases earlier and creating personalized treatment plans, AI can help reduce hospital readmissions, leading to cost savings for both patients and healthcare providers. 5. Improved research. AI is also contributing to the advancement of medical research. By analyzing vast amounts of data from clinical trials and patient records, AI algorithms can identify new patterns and trends that may lead to breakthroughs in medical science. For example, AI can help identify genetic mutations that may indicate a higher risk of certain diseases or conditions. This information can then be used to develop targeted therapies that are more effective than current treatments. 6. Better patient engagement. Finally, AI can help improve patient engagement in healthcare. With the rise of wearable devices like smartwatches and fitness trackers, patients can now track their health data in real time easily. By integrating this data with electronic health records and other medical data sources, AI algorithms can provide patients with personalized insights into their health status. This information can empower patients to take an active role in managing their health, leading to better outcomes over time. Artificial intelligence, AI, has been making headlines across all industries, especially in healthcare. Healthcare providers are increasingly turning to AI to improve patient care and reduce costs. However, with the advantages of AI come certain risks that must be addressed. One of the biggest risks associated with AI in healthcare is patient privacy. With the amount of data that is collected and analyzed by AI, there is a risk that this data could fall into the wrong hands. It's important for healthcare providers to ensure that patient data is stored securely and that only authorized personnel have access to it. Another risk associated with AI in healthcare is bias. Bias can occur in several ways when it comes to AI, including in the way algorithms are designed or in the data sets used to train them. For example, if an algorithm is trained on data from a certain demographic group, it may not work as well on patients from other demographic groups. Bias can also occur if an algorithm is designed based on assumptions rather than empirical evidence. A lack of transparency is another risk associated with AI in healthcare. Healthcare providers must be able to understand how an algorithm works and what factors contribute to its decision-making process. Patients must also be made aware of how their data is being used and how decisions about their care are being made. Another risk associated with AI in healthcare is regulation. As more healthcare providers adopt AI technology, there needs to be proper regulation in place to ensure that these technologies are being used safely and effectively. Without proper regulation, there is a risk that patients could be harmed by these technologies or that they could be used improperly. While this may seem like a far-off scenario, it's important for healthcare providers to consider how AI will impact their workforce and what steps they need to take to ensure that their human staff remains relevant. Artificial intelligence, AI, is rapidly transforming the healthcare industry by bringing new opportunities for efficiency, precision, and personalized care. Healthcare institutions are becoming increasingly reliant on AI technologies to improve patient outcomes and reduce costs. As a result, salaries for professionals skilled in AI technologies are growing at an exponential rate. In this technical instruction video, we will explore the salary range for AI professionals working in the healthcare industry. The average salary for an AI professional working in healthcare ranges from $76,000 to $160,000 per year. However, this figure can vary depending on various factors such as job experience, education level, and location. Entry-level positions in AI technologies typically require candidates to hold a bachelor's degree in computer science or a related field. In addition, candidates need to demonstrate proficiency in programming languages such as Python or R and have knowledge of machine learning algorithms. Entry-level positions include roles such as junior data scientists or machine learning engineers. As professionals gain more experience and skills in the field of AI technologies, they can expect to earn higher salaries. Mid-level roles such as senior data scientists or lead machine learning engineers can command salaries upwards of $120,000 per year. For those who have achieved mastery-level expertise in AI technologies and have a strong track record of delivering innovative solutions to complex business problems within the healthcare industry can earn salaries exceeding $160,000 per year. These high-level roles include chief data officers or directors of artificial intelligence. In addition to technical skills and qualifications needed for an AI professional position within healthcare institutions, soft skills like communication and problem-solving abilities are also critical. This is because an AI professional must work closely with cross-functional teams comprised of clinical staff members and IT personnel. An effective approach that helps develop these essential soft skills is through gaining experience through internships, or entry-level positions that provide hands-on experience and exposure to the healthcare industry. As with any profession, location also plays a significant role in determining AI professionals' salaries in the healthcare industry. For instance, AI professionals working in California or New York might earn more than their counterparts working in Oklahoma or Louisiana. Another factor that can influence an AI professional's salary is the specific domain knowledge they possess. In other words, possessing knowledge and experience that is specific to certain areas of healthcare can lead to higher salaries. For instance, having knowledge of electronic health records, EHR, or medical imaging technologies can be valuable for AI professionals working in these areas. Similarly, those with expertise in clinical decision-making software, genomics, or artificial organs and prosthetics will be highly sought after by healthcare institutions. In addition to the financial rewards associated with a career in AI technologies within healthcare institutions, there are also many other benefits. These include opportunities for personal growth and development as well as opportunities to contribute to improving patient outcomes and reducing costs. AI technologies have been shown to bring about significant improvements in healthcare outcomes such as reducing readmission rates, improving patient safety through early detection of adverse events, and identifying patients at high risk for various chronic diseases. Furthermore, from a business perspective, AI technologies are seen as a way to reduce costs while increasing efficiency. This is because data analytics provided by AI can identify inefficiencies that may have otherwise gone unnoticed, thereby resulting in waste reduction.